Okay, so now we are done with the first stage, and fortunately all the skin cancer was removed, and now we are left with what we call a defect. Defect meaning spot or an open wound that needs to be then repaired. In this particular scenario, we have a couple of options. One of them would be when we do a repair that involves simply connecting one edge to the other. Imagine that we're simply connecting the skin and stitching it in a line. Linear repair. That's usually the approach I like to take. And usually, if we can do a linear side-to-side repair, that's what we try. And in this particular scenario, given that it's small, in a place where we have enough give, then that's what we're gonna do today. Assuming that we couldn't do that, another common repair would be a graft. Graft would be taking another spot of skin somewhere else in the body, removing it from the skin, and using it so-called like a patch. The good thing about that is that I don't need to stretch the skin to make it come together. I could simply put a patch. The negative to that is that I have to create a second wound. So that's why grafts, unless I need to, I don't do them, but sometimes they're needed and they're very good. Another option is when we close the skin using some other area by realigning the skin. Let's say I was trying to get the skin from here, and then I was sort of stretching it and moving it in circles so that I could kind of cover the area. Sometimes we need to do that. That's considered a flap. But again, being small and easy, the best repair, in my opinion, would be to do a simple linear repair. And in this particular scenario, I decided to use a suture called PDO. PDO is one type of material that allows me to suture the skin, and if it's under the skin, it's dissolvable, meaning the body will break it down over the next 2 to 3 months, and the sutures would dissolve on their own. Right now, we're gonna do a subcuticular suture. That's a suture under the skin that grabs a portion of the epidermis and dermis, and the suture is buried under the skin. Now, sometimes in order to close the skin, a circle, like in this scenario, sometimes the wound has to be extended to make it look more like a football shape. It's like something that patients often tell me, to reduce the edges, so to speak. As you close a circle, although edges sometimes pucker up. So you may find in a procedure like this, sometimes extra skin is removed in order to align the edges better
of the wound.
Correct. But in her case, and because of experience, I know that the finger could tolerate a little bit of extra puckering on the edges, and it minimizes the need, again, for me to remove healthy skin. I chose to close the top layer with a running suture. That's where the suture is sort of running and it's not being cut between each loop. It's just simply being run. Now, as we clean the skin right now, for purpose of the video demonstration, you would see that the skin has come together nicely. And some of this puckering or bulginess on the skin is quite normal on the finger. And within about a month or two, this flattens and it becomes a simple, thin scar that is easily hidden.
Cat scratch, you told me.
Cat scratch. You can see another excision here that is still healing. It's only about 2 weeks old, and it's starting to get flat, and it's starting to become like a cat scratch. Within about another month and a month from this one, this both will look like a hairline scratch. At this point, the wound is cleansed and it will be dressed or bandaged sutures in this location usually get removed in about 10 days.